This podcast series consists of 4 episodes in total. They are all dedicated to EPICENSUS. EPICENSUS is a UCB-funded initiative to raise the standard of care for patients with psoriasis by gaining insights from patients, payers, and clinicians into the current standard of care and posing potential improvements. This series of podcasts has been financially supported by UCB Biopharma SRL. However, none of the podcast speakers have received any of the financial contributions for being part of this podcast. Hello, dear listeners, and welcome to EUROPSO podcast series about EPICENSUS. This is our final episode, number 4, and it is called Access All Areas. In a nutshell, our job is to advocate for universal access to care, and we will see how this relates to the EPICENSUS. The final episode is discussing the importance of accessing timely care and innovative treatments, and we can, through our discussion later on, summarize the learnings from the overall podcast series. My name is Jelena Misita. I'm a patient advocate with around 20 years of experience in healthcare communication, and my guests today are Elisa Martini. She's an advocacy and policy manager from IFPA. She's committed to social justice and sustainability, and she advocates for millions of people living with psoriatic disease worldwide due to her role in IFPA. The other guest, and we are particularly honored to have her, is Ilse van E from the Netherlands, from the Psoriasis Patient Organization in Netherlands, and they are doing a lot of amazing projects we will hear more about later on. So, to shortly recap what happened in previous episodes, we saw that psoriasis places a great burden on all aspects of patients' lives and demands a team of different specialties to effectively manage comorbidities. Yet, healthcare professionals lack knowledge on the extent of the burden and comorbidities, and many patients do not have access to the specialists they need for optimal care. So before moving further, I would like to hear from both of our guests shortly about their experience with psoriasis and what motivates you to fight this good battle.
Thank you. Thank you for the introduction. As you already mentioned, I work for IFPA. We are the International Federation of Psoriatic Disease Associations. So we are an umbrella organization for all the association and patient organizations in the world fighting for people living with psoriatic disease. I have a little bit of research background, and that's where I came in contact with psoriatic disease, and I really wanted to do something for the people living with it, and that is why I'm so proud to work for an organization like IFPA and to be here with you and participate into this podcast.
Thank you, Elisa. Ilse, what inspires you to fight for psoriasis patients?
I'm a patient myself. I've had psoriasis since I was 4 years old, so quite some years now. And a few years ago, I thought, well, maybe not only take care for myself, but take care for a lot of more people and do some volunteer work. So I was a member already for many years for our own patient organization, and I said, well, how can I help? And I think it's very important that patients take part in the discussions about how to get their care and how to make care more, really put the patient in the center, because we live with that disease 24 hours a day. And we also know what we would like to have and what we like to want living with psoriasis. So now I think I'm about 15 years a volunteer and bring my experience in.
Well, we're talking about a lot of years of valuable experience. And based on your experience, I would like us to start today's talk with something that the EPICENSUS program identified, which is that access to innovative treatment is suboptimal, which means that it's not where it should be. So how do patients currently access treatment in the Netherlands? What is your experience?
Well, it's not optimal. Now in the Netherlands, if you have psoriasis, you go to the primary care keeper, the huisarts. And if it's not very severe, then you can get treatments with lotions and so on. But if you have more severe psoriasis, then you can go to the dermatologist. And still a lot of people find that step is not a normal step. It's not for all people available. And at the dermatologist, you have a lot of choices, but really getting to that, it's stepped care in the Netherlands. So you first have to put lotion on your skin, then you have the light therapy, and for later you have the therapy with injections or pills. And you really have to go through all those steps to finally search for therapy that really works. And that search is really hard for people. And some of the hospitals where dermatologists work, they have a lot of options in, for instance, biologicals, but not all hospitals have the same options. And there are also a lot of skin hospitals, only for skin, and they have not all the options as well. So if you don't get the signal from your doctor, you have to go further to another hospital, then you probably get stuck in lotions or light or maybe pills. And it's very important that patients really know what all options are so that they can really make a choice where they want to have their care.
Hearing this from you, it seems that they are given a number of options before they qualify to receive treatment, so to speak, serious treatment, to receive drugs or injections or anything. So they first try everything else before that. And sometimes it can be delayed or it can be late for patients to suffer for a prolonged time. So why is it important that patients receive the best treatment for them from the start?
Well, I think even a lotion or a pill or the light therapy is also a serious medication, a serious therapy. But if you have severe psoriasis, you can wonder if it's better to have the best working medicine at the start or that you have to go through all that journey. And if you serious medication also have more pros and cons, so it affects more of your body. So I think it must be a balanced choice. And I think that can be speed up by really going through that journey and telling patients that it's a journey, but also what's the time limit? How long do you want to put lotion on your skin, or do you want to try light therapy before you go to that next level?
Yes, I apologize. When I said serious medication, I wasn't actually meaning anything bad. I only thought that to match the condition, if someone appears with severe symptoms, that's why I refer to severity of patient, because I only imagine that if someone comes with 90% of the body covered in a severe flare-up, that there is a slim chance that just a lotion would help. So based on your now experience, Elisa, as a patient advocate, what are the current challenges for patients accessing the best treatment for their needs? You have a global perspective, so what is your opinion?
Well, the journey from having the disease to optimal treatment and care is very long and has various steps, and challenges exist basically at all levels. So the journey of a person with psoriatic disease starts with the diagnosis, going to a doctor to get a diagnosis. And as it was said, usually people go to see their family doctor, the primary healthcare physician, and it's not everywhere like that. There are some countries, for example, Japan, when people can access the specialist directly. And here comes the first challenge, the first roadblock, let's say. The primary care physician needs to know about the disease, needs to refer to a specialist if necessary. Some people in some countries, for example, in UK, in France, in the Netherlands, we have heard some people can receive a diagnosis directly from the healthcare physician, whereas in other countries, we have learned that almost all people are diagnosed by a specialist, usually a dermatologist. So this prolongs a little bit the time to a diagnosis of psoriasis, which varies. This time to diagnosis varies very much, depending from country to country, even region to region. It depends if you have access to the specialist that can give you diagnosis. So this is one of the challenges. Then we get to what was already mentioned, which is a stepped approach to therapy and care. Unfortunately, it is like described in many countries where, like in the US, for example, in Australia, in China, in the Philippines, where you have to fail other treatments to go further and access a treatment that maybe works better for you. And then maybe you arrive to this last step where you finally have access to a treatment that is appropriate to you. And then there are different things to consider. for the availability of treatments. As we said, as it was said during this episode, the treatment has to be available, but it's not only that, then it has to be reimbursed. So in some places, the treatment maybe is available, but it's not reimbursed. So you need to pay out of your own pocket these medications that go on for life. And this is a huge financial burden for people living with the disease. So you can see challenges exist along the way, in many steps of the way. And our job is really to find the best way to get to optimal care of people with psoriatic disease, but also not having them have to choose between buying food and buying their medications. So this is also very important.
Thank you. This was very valuable, and it strikes me that it differs from one part of the world to another, so much so that I wish to ask Ilse, what is the situation in Netherlands? Do patients in your country need to demonstrate treatment failure before getting another medication, and how is this being done? How do you get another medication? How do you switch from what was previously prescribed?
Well, you do, and I think that's quite logical, because if you have a treatment that works, you don't need to change. But then you go to your primary care keeper or your dermatologist and you have to tell them this medication doesn't really work for me. But we also know that patients really have to search for that cure. So if you have been back to the dermatologist for the third time and it really didn't start and worked, that's very difficult. And in the Netherlands, I think we have a good healthcare system. So if you got a biological, it's you don't have to pay for it yourself, but you pay an amount every month, and that's quite equal for everybody. So that's not the burden, I think. But even in the Netherlands, it's not all equal in the whole country, because if you go to a normal hospital or academical hospital, there are more options in the academic hospital. And I think it's very important that the patients really know that there are so many options. And in the Netherlands, we have quite some options, and also very important that what options that carekeeper in particular in that hospital can give you.
Well, I think some of the things that you just mentioned coincide with, and I think it's a good opportunity to mention that EPICENSUS proposed a call to action to treat patients based on their individual needs, to endorse a patient-centered approach to care based on the clinical needs of individual patients. So basically it coincides with what you said, but how far are we from bringing this to life for every patient? How difficult is it to bring this to life?
Very difficult. A lot of that information is available for carekeepers and not already customized for patients. And in the Netherlands, we talk a lot about samen beslissen. That means deciding together. Because if you want to have an intervention, you have to consent to that intervention. So if you want to have medication, you need to consent having that medication. But if you really want to decide together, it means that you have to talk and have a good conversation with your carekeeper to know what your options are, to know how it is with you and what's important for you. And if, for instance, you have a really busy job and you have to go 3 times a week to the hospital, that doesn't fit. When I just got my baby quite some years ago, the doctor said you can do a light therapy and you have to be in the bath in the hospital for an hour and then on light therapy. And I said, are you going to look for my baby then? Or can I bring him with me? And so it has to fit in your life. That's also as important as how good does the therapy works. And if you really have that conversation about the possibilities, about the pros and cons, you can really decide. But that's also very difficult for patients, even for myself. I think I know quite some things about psoriasis. But if you are sitting with a doctor, you don't always find the words, or when you're busy, you don't always have the right words. And even in a situation where the doctor tells you you have psoriasis and it's a disease and you can't get rid of it, it does something to you. So if it's something hurts, you make the right logical decisions. That's very difficult.
Thank you. And Elisa, from your more global perspective, what can patients do to ensure they receive treatment tailored to their specific needs?
Well, there is this concept in healthcare that every healthcare system strives towards, which is patient centricity, person centricity, a person-centered model of care. And it's exactly what we were talking about, working patients and doctors, for instance, working together. So for that, we need many components to be in place. We need an informed doctor. We need a patient that is also informed and aware of the disease and ready to ask the questions they want to ask, but also communicate the things they really want to communicate. We need doctors who have the time to listen to and have a conversation with the patients. We need doctors that need to see, for example, dermatologists, beyond the skin symptoms and the whole person. So this is really a complex ecosystem that has to be formed and go together. And what was said about the time that the person needs to invest into finding the right conditions, the right treatment for them. It's really many things to take into consideration, and the EPICENSUS call to actions, many of the call to actions are really about trying to galvanize the attention to these kind of issues. I really liked, for example, when we talk about digital health that could facilitate communications, and I liked how the discussion went into, well, yes, maybe this is a good approach for follow-ups, to follow the disease. Maybe it's not appropriate for the first encounter to when it comes to diagnosis, but it's also not for everyone, because not everyone is tech savvy or available to willing to show certain parts of the body through a camera. So this is really person-centered care, listening and establishing a dialogue and find really something that works for that individual.
And Ilse, what patients can do to ensure their healthcare professional is aware of their treatment needs? Except with, we can talk with the doctor, but how do we make them aware? How do we make them listen to the patient?
That's a difficult question. I don't know really the answer how we can make caregivers listen to patients, but I think it's what makes your job fun, because people always make the difference. So I would really advise that to doctors. But I think there are some options that doctors can use. They can give good information to patients and just ask some questions. And if you ask a question, just look at the patient and not at your monitor or computer. Because if you really have a conversation, it's not only with your ears, but it's with your eyes, and have contact. And I think that doesn't take time. And if it takes time, no, you have more fun and a longer time at work, so that's okay as well. But you can also help patients by telling them what all options are, or helping them with things that they can think what's important for them. In the Netherlands, we made a small card from what's important to you. Do you find it important that your treatment works in 1 week, or do you find it important that it works for a longer time? I think one of the things that also is difficult, that having psoriasis and having a lot of that it comes up and your medication works inflammatory, is that we are quite used to it, that it always comes back, and that we also accept sometimes that it's there. But with these new treatments, it's not always the case. And I think knowing that these options are available is very important for patients. It's not only that we have the medication, but how good they work, and knowing what it does to you when you don't have psoriasis. For myself, I use a medication now for 2 years and I don't have any spots. And even still, I still feel myself a patient, but it's not gone from my body, it's not gone from my mind, but it's so much better having a medication that works. I would hope that every patient could have a treatment that works.
Of course. And we hope that this universal access to therapy is not just a phrase, it's something that really becomes part of our daily life. And it particularly touched me what Elisa said, that people shouldn't be forced to make choices like whether I should buy food or medication. This should be covered in another way. I would like to thank you both for your valuable insight. I learned a lot today from you, and I hope our listeners have too. This is the final 4th episode of EPICENSUS podcast series, and with this we are making a full circle, because we talked about psoriasis and its associated comorbidities and how they negatively affect all aspects of patients' quality of life. Also, in previous episode, we covered the topic of healthcare professionals who don't recognize the extent of the burden and lack knowledge of comorbidities and individual patient needs, which then contributes to poor access to tailored treatments. And we talked about the education which is needed to raise awareness of all manifestations of psoriasis and to facilitate timely diagnosis, referral, multidisciplinary management, and access to optimal treatment. So now, after all this being said, now the real call to action for our audience would be, how can you raise awareness of psoriasis? And this is something that I would like to close with. I would also like to invite our audience to come and visit EUROPSO website and discover our new tool, psodata.eu website, on which they can find all available clinical trials currently going on in Europe. And for any additional information, you have our contact details on EUROPSO website. Thank you, Elisa. Thank you, Ilse.
Thank you.
It's been a real pleasure. With this episode, we finish our cycle of 4 EPICENSUS episodes, this being our 4th and last episode in this series. We hope you enjoyed it, we hope you learned something new, and we hope you will continue to follow EUROPSO on social media and find out about our other topics as well. I wish you goodbye.